share your video. And I will wait for 2 minutes, and then I will give the opening reminders and hand it to Polly.
Great.
Good morning, everyone who has already joined. We're going to give people 1 extra minute, and then we will get started. Okay, good morning, everyone, and thank you so much for joining us. Before we get started, I just have a quick housekeeping announcement. We do have a designated time for questions near the end of the webinar, so please hold your questions until then. But if you think of a question during a presentation, you can type it into the Q&A box. Please use that box rather than the chat box. And without any further ado, I'm going to pass it to Polly for our introduction. Go ahead, Polly.
Good morning, good afternoon, good evening, and welcome to Leaders on the Line. Please allow me to introduce myself. My name is Polly Dunford, and I'm the new president and CEO of IntraHealth International, an organization committed to supporting health workers because health workers save lives. We're so excited today to hear directly from talented and courageous health workers who have agreed to share their stories with us. We are co-hosting this event with the Frontline Health Workers Coalition, and this is really an extension of World Health Worker Week, which highlights the importance of work of health workers worldwide. With the emergence of COVID-19 and the global pandemic, our collective work together has never been more important. It's essential to hear directly from these leaders on the line so that we can better understand their realities and their challenges to help us target our efforts so that we can safeguard them and support them to do this extraordinarily important work during this time. So with that, I'm going to introduce Sam Rick, who's the Deputy Director of the Frontline Health Worker Coalition, who's going to introduce our courageous health workers so that we can begin hearing directly from them. So without further ado, let me hand it over to Sam. Thank you.
Hi, everyone. Thanks, Polly. I'm happy to introduce 3 health workers who we've been working with over the past year on storytelling and advocacy. We're grateful for funding from this project from the Medtronic Foundation, who are also members of the Frontline Health Workers Coalition, which, if you don't know, is a coalition of around 40 organizations dedicated to increasing investment in the recruitment, training, and retention of frontline health workers in low and middle income countries. Margaret, Maxima, and Malik hail from different parts of the world, and all 3 have incredible stories to share of the work they do and the issues that they want to elevate. First, we'll go to Margaret Odera, who is calling in from Nairobi now. She's a community health worker and mentor mother to other mothers that are pregnant and have HIV and want to prevent transmission from themselves to their children. Margaret, are you on? I also want to caveat that we know that these health workers are in very different parts of the world with very different amounts of connection, so we have a backup plan if they're not able to connect.
Margaret, you're still showing.
My name is Margaret Odera.
We can hear you, Margaret.
Okay, thank you very much. My name is Margaret Odera, a community health worker and a mentor mother. working in Mother Health Center. And basically my work is just to be on the front line in elimination of mother-to-child transmission of HIV, because I'm also HIV positive myself for 20 years now. And my work is just to encourage the mothers to take the ARVs. I also encourage the community on the prevention of multi-drug resistant TB, and encourage the women to take the cervical cancer test. Yeah, so just to encourage the community to live a better, healthy life. Thank you very much.
Thank you, Margaret.
Yeah.
Margaret can go ahead and share her story as soon as she's ready.
Hello, come again?
You can go ahead and share your story that you've been working on.
All right. I have a lot of mothers, almost 783 mothers who have born HIV negative children, including my own son. And I have this story of this woman in particular who's called Faith Kasandi, who came pregnant, 5 months pregnant, and she was really hysterical. She did not understand, how being HIV positive means to her. But I'm so grateful that right now she's very bold. She has 3 children. She has twin girls who are HIV negative right now. She has a 7-year-old baby girl who is also HIV negative right now, and I'm so grateful because of her. And yes, there are so many other women who really need my support in our community. When this now, the other pandemic that is now on board is the COVID-19, of which we have to just, I have to encourage the mothers to be extra careful on their hygiene and their, taking their diet very well, and also on taking drugs so that they may continue living a healthy life. Yeah.
Thank you, Margaret. Our next health worker speaker was unfortunately unable to join the call because of an electricity issue in Bangladesh, but it's Maksuma Akter, who's a midwife in a Rohingya refugee camp in Bangladesh, and we have a recording of her story to share for you.
Within a 7 blocks area live over 20,000 people. Most live in sheds. Some families, 7 people to a single room. Children don't run free in the street. They are confined to small areas. These are refugees living in Rohingya refugee camps. They have fled their country to escape persecution, but most of them left lives of possession to find themselves inside a fence, with nothing but the clothes on their backs and their families. They are anxious, depressed, and suspicious. The women continue to get pregnant because they do not have knowledge of long-term family planning solution. My name is Maksuma Akter, and I have been a midwife in these camps for the last 2 years. I am 23 years old. When I was 10 years old, I watched as my cousin gave birth at home to a stillborn baby. The devastation of that moment in some ways inspired me to grow up and help women to have healthy babies. It is my deepest desire to serve people and provide mothers with the pleasure and happiness of bringing healthy life into this world. But in the beginning of my time as a midwife inside the camps, it was very difficult to help pregnant women. For one thing, the refugees did not trust us midwives. In their minds, we were too young to know what we were doing. We did not speak the same language. Even though we were trained well, most refugees preferred in-home births with traditional birth attendants who do not have the proper training to deal with unexpected outcomes of various births. There was so much mistrust. Even when mothers would have facility births, some with postpartum issues would refuse to referrals to hospital outside the camps, even when we provide ambulance transportation. Shortly after I started working as a midwife, there was a mother with postpartum hemorrhage that desperately needed a blood transfusion, but no one in the camp would donate their blood. This woman died in an ambulance. Our role as midwives over the last 2 years has been a job of trust building. When a woman comes into our facility to confirm pregnancy, we try to educate her. We let her know of important prenatal care, proper nutrition. We reach out to family members to create a network of support to promote a proper birth plan. We identify high-risk pregnancy and create a schedule for follow-up appointments. Our primary healthcare facility is a place to build trust between mothers and healthcare professionals. A woman once came into our facility. She was pregnant and had suffered 8 miscarriages. She had never received proper care from our midwives and professionals. We established trust and built a relationship that would ensure the health of her and her child. She delivered a healthy baby in our facility. Over the last 2 years, the gap between refugees and midwives has gotten smaller. The number of in-facility births is much higher now. Also, women are starting to use long-term family planning solutions, which will reduce numbers of unwanted pregnancies. A few weeks ago, I delivered a baby who was not breathing. Upon birth, we used our expertise and resources in the facility to help bring breath to that young baby. It gives me a great pleasure and joy to have the privilege of placing a healthy newborn baby into the arms of its mother. I love my work. Thank you. Thank you so much.
Well, we're very thankful for that great story from Maksuma, and I just want to flag that if anyone does have any questions for her, I can send them to her by WhatsApp. She's waiting by her phone, even though she's unable to connect to the Zoom call. Next up, we have Dr. Malek Benkhayal, who's a physician in Libya working on chronic care conditions and NCDs in a crisis situation under normal conditions, but also facing the increasing threat of COVID-19. Malik, over to you.
Yes, thank you, Sam. Thanks for having me and giving me this opportunity to share my story with you guys. My name is Malek Benkhayal. I am 34 years old from Benghazi, Libya. I'm general practitioner in primary health care in Benghazi. And yes, I would like to start to share my story. Okay, a 70-year-old man was admitted to the hospital and presented with upper abdominal pain. He vomited twice. He was diabetic and hypertensive, and he's also an ex-smoker. As his doctor, I needed to exclude acute medical conditions. And given the medical history in this case, I needed to rule out a heart attack or what's so-called myocardial infarction. Unfortunately, in my hospital, the only diagnostic test available was an ECG, and that was inconclusive. But even if it was conclusive, we need to do more tests, and my hospital did not have the resources to conduct those tests. So I referred the case to the nearest healthcare facility that was capable to manage the case. This facility was 1 hour away. And as is said in the medical practice, time is muscle. The more time that passes, the more the heart muscle becomes irreparably damaged. I felt powerless. I was ashamed. I am a doctor, a healer, and I couldn't provide the necessary care this man required. When I decided to go to medical school, I was expecting a career full of thrills and achievements, and of course, a great deal of money. After my graduation in 2012, I got a job at a large medical center in the east of Libya, Benghazi Medical Center. However, the country had just endured the 2011 revolution against Gaddafi's regime. And Libya slipped into a civil war in 2014 that started in my city, Benghazi. It was a turning point for hundreds of thousands, and I was no exception. The challenges became more dangerous, and everyone's #1 concern was their own safety. For doctors, it wasn't guaranteed that we would make it to and from the hospital every day. As a frontline health worker, I witnessed many violent attacks against medical personnel. Even some have lost their lives in this context. Some have even been kidnapped. Civil unrest affects everyone, and the stress was beyond anything I could have ever imagined. And that doesn't even count the stress of working in the medical field. We were emotionally destroyed. We lost hope, and some had left the country and started life in another place, away from his or her home. The government was in chaos, and the resulting economic crisis increased the difficulty of everyday life challenges. My salary was being withheld, and I still remember that when I was paid, the amount equaled $100 per month in 2016. Imagine raising a family in $100 for a month. As a result, I quit my job at Benghazi Medical Center, and I started to work for international non-governmental organizations, where I feel partially satisfied, as I was helping vulnerable populations, whether internally displaced people, the refugee, or detainees. Libya's healthcare infrastructure has been obliterated, and as a result of the civil war and instability, people who need care are not seeking it. In 2016, I worked as a general practitioner in a mobile medical unit, where we traveled from community to community to bring medical resources to the people. There were so many people who needed us, most suffering from some sort of non-communicable diseases like hypertension and diabetes. So many of my duties in these communities went beyond the daily work hours. I would give out my phone number, offer advice when called, or visit patient in need after hours. I've even paid for patient medication out of my own pocket. But many people with serious illnesses need more. I once examined a patient who complained of chronic abdominal pain, and I found that there was an underlying serious medical condition as revealed by an ultrasound. The radiologist report suggested intestinal tuberculosis. However, further clinical workup was advised. I worked hard to get him the medical care that he required. And in the end, I had him sent out of Libya to do paracentesis for cytology in Tunisia, and intestinal TB was confirmed. So much time and so much expenses required to perform basic diagnostic procedures. This type of situation undermines the therapeutic relationship a doctor should establish with with his or her patient. The events I talked about today are all from the past, but the same issues are in play today. A few months back, 6 physicians were kidnapped from a mobile health unit in the Tripoli area near the capital. For 2 weeks, they were held until they were released. They were released. They weren't hurt, but that doesn't change the fact that healthcare providers are not always safe. In addition, I recently left my job at the hospital. Like in the past, my compensation became less and less reliable, and I could no longer live in such a manner. Every day I receive phone calls from my family or my friends who are in desperate need of medical solutions, medications, equipments, procedures. Many people lack access to proper health care, and now doctors like me are forced to leave the profession. COVID-19 adds a new level of anxiety within the medical and governmental sectors of Libya. Currently, only 49 cases of COVID-19 have been reported in Tripoli and Benghazi. We are all nervous and paranoid because if we see a spike in cases, it would be a mass tragedy because of our inability to treat patients. Libya was already on the brink of a medical crisis, and I am afraid that a large COVID spike would break us. I worry for my country. I worry for my people. Thank you.
Thank you so much, Malik. Yes, we in the global health community are all very worried about countries like Libya that are overwhelmed under the best of circumstances. I have a few questions for Malik and Margaret, and then all of the attendees can please put their questions in the Q&A box, and we will get to them after this round of questions. Casey will be our question fielder. So first, for Malik, what can you tell us about how your work has changed since what happened in your story? Have you changed how you worked with people? Have you changed with how you interacted with patients?
Actually, the story I shared is very updated. But however, since a few months back, like 2 months back, I quit my last job as general practitioner in the primary healthcare because of salary issues. Because the last salary I received, it's like 4 months back. We have some economic crisis, and the consequences of delaying or withholding salaries is very common in healthcare, in the healthcare sector in Libya. So I need to make a living and so try to find some sort of income to bring foods to my family and pay my bills and stuff like that.
What are you doing to supplement your income when it's not coming?
I started a side business like dealing in medical equipments. Also, I go to private clinics once a week. It's little income, but I figure out how to deal with my bills and my stuff.
Great, thank you. Margaret, if you're still with us. Margaret?
Yeah, I can hear you.
Great. Can you tell me how the COVID-19 pandemic is playing out in your daily life at work and in your community? What sorts of interventions is your facility putting in? How has your work changed? Can you hear me?
I can hear you. Hello?
Hi. Can you tell us how the COVID pandemic is playing out in your daily life and how your work has changed?
Okay, it has really been a challenge since the first coronavirus was reported in our country. And it has really changed the way we work, because right now I cannot have the one-on-one talk that I used to have with the mothers. I cannot go out to the community to go and just visit them in their houses, because right now the visits have been restricted. And also personally, the fear has grown into me since my immunity system is already compromised. And I'm really concerned about myself and my children. You know, this is a new fear that has just gripped me. And people, okay, in our system, the comprehensive care unit, we were seeing these patients once in a month, but right now these patients have to come once in 3 months, so that they don't actually come every month. So there is that, we don't communicate much the way we used to communicate. And the fear has now come from from infection of HIV to, the infection of COVID-19. And this has really changed my perspective as far as hygiene is concerned, because right now we have to teach mothers on sanitation, on which we never used to do that some time ago. So right now we are concentrating so much on the coronavirus, and we are giving little health talk about the HIV pandemic. And this is because we have come to realize that we as Kenyans have not been taking this coronavirus very seriously. And it has been a concern nationwide, and even in our own place where I live in Mathare. Given that this is a slum area and it's a very dense populated area, that is a concern, and it has really changed my life. It has really changed my perspective on the way diseases move fast. And yes, I'm really concerned. I really fear for my own life, since I have to see these patients every day, and with the shortage of masks and with the shortage of water, even in our community in Mathare slums, it's really a concern, and I don't know what we can do, because when I tell the community that you need to wash your hands and there is no water, you need to stay indoors, and they have to go look for water outside. So yeah, it has really been a challenge. And but all in all, we have continued to be resilient. I have continued to be resilient, just to tell the clients just to use what they have. If they have the water, if they use water. If I don't have a sanitizer myself, I have to make sure that I, wash my hands and with soap and water. And then, given that I have also small kids in my house, I have to, from the hospital, we don't have, as a clinic, as a health workers, we don't have anywhere to stay, so that we may stay far away from our children. So I have to just come back home and meet my young boys, and it's really something that is of a concern to me. And given that my work is very important to me and my family, yeah, it's a concern actually. Yes. Thank you
for sharing that, Margaret. You said that early on Kenya wasn't taking the crisis seriously. Can you talk a little more about that?
Yeah, it's like, say, last month, during the month of March, it was like when you tell people to, just to stay at home as much as possible. Some were just asking you, is there any ghost? Is the coronavirus a ghost that is outside there? Because the Kenyan nation don't believe so much in the things that they cannot see. And the same strategy that was used when the HIV pandemic came in to just that is child prevention of HIV. I think it is the way, it is the only way that Kenyans can really learn, can really get into, to believe that this coronavirus is very much real. Because right now, we have started seeing deaths. We have 11 deaths as of today. We have 234 people countrywide who are affected for that. The last 2 weeks, I could see concern. They are not taking. I could wear a mask in the streets and people are just laughing at you. It's like they are seeing, somebody who's really funny. But right now, everybody is wearing a mask. And the reality is slowly creeping on the Kenyan people. They right now, I can see a lot of people wearing masks in the streets. And even in the hospital, there is nobody who is allowed to enter the hospital facility without a mask. So apart from the Kenyans facing the reality on ourselves, the police has also to just reinforce, because it's like the people fear police and the curfew more than the coronavirus itself. But it's slowly, the people of Kenya are slowly understanding that this is a pandemic, because we have witnessed the death of small children. We have witnessed death of, this person. There is this man from Siaya County who was just buried 5 days ago of corona. And, the people of that place really wanted to demonstrate, and they wanted to go to court, saying that this person has been buried in a way that is not welcoming, because he was just put in a body bag, and then he was put on a shallow grave, and the funeral arrangement was not done, and the Kenyans really felt very bad. But as much as now the government is reinforcing and teaching people that this is because this coronavirus to prevent the coronavirus, it has nothing to do with discrimination. It has nothing to do with hating somebody. I think slowly by slowly the reality is creeping in the country. Right now, people are washing hands even in the shops, not like last month when you tell somebody buying something in the store that she should wash hands, and they tell you, I don't have time for that. Right now, the reality is slowly creeping in. Yes, thank you very much.
Thank you, Margaret. Those are really important points for us to know as we go forward and we discuss what is going to happen in lots of African countries if COVID hits. Yes. Thank you.
Yes, and my concern also, another concern is today, as I got out of my facility, I never saw any sanitizer. There was no sanitizer in the hospital facility. We don't have the ventilators. We don't have the intensive care units. And given that I work in a slum, and this slum consists of a population of 10,000 people, so My fear is I don't know what will happen when this coronavirus starts spreading. So it's really a concern. And so when we identify somebody who has flu-like symptoms and a high fever, we have 2 ambulances. So we have to refer them to Kenyatta National Hospital or Mbagathi Hospital, which are the only hospitals, public hospitals right now dealing with the coronavirus. Yes, thank you.
Thank you. Malik,
Yes, sir.
I know that you mentioned that you're very scared of what would happen if COVID hit Libya pretty hard, given the situation there right now. What would be your most urgent request to change what's happening in the health system in order to prepare?
Actually, from my point of view, it is a multi-sectorial approach, whether healthcare, security, financial. It's a very difficult task for Libya to handle such pandemic. Meantime, I think they need to increase the workforce, healthcare workforce, the trained one, especially ICU doctors, and also they started some like infection control contingency plan. But because of Libyans situations, I mean the ongoing armed conflict, we have 2 governments, one in the west and another one in the east. Each government tried to establish its guidelines and to face danger, the threats of this pandemic. So first of all, they need to work with each other, because it is very it's a mosaic picture in Libya. It's too many interactors and too much stakeholders to deal with each of them. The difference between the rural and the urban. So I hope they will discuss how they can collaborate between each government, between these 2 governments, and increase the finance resources to help healthcare personnel if things goes very bad. I mean, yes.
Yeah, that's a huge challenge. I mean, the government total response.
Wartime is very difficult with the pandemic.
Yeah.
I cannot imagine if we say a spike, what mass tragedy will be the scene.
Yeah, government response has proven to be extremely important in mitigating the effects of COVID, for sure.
They are still fighting. Yesterday, they are still fighting. They don't care about the pandemic, unfortunately.
And for both of you, can you tell me how having frontline health worker teams enhances your work? How do you work with other cadres of health workers in order to do your work?
Can you repeat the question, please?
How do frontline health worker teams enhance your work? How do you work with other cadres of health workers in order to ensure that your patients are kept safe?
Actually, because of the recent curfew and the lockdown of the city, it is difficult for people to access to healthcare. For example, my mother, she has infected hemangioma that need a plastic surgeon to remove it, and I'm trying to find one since 2 weeks, and I couldn't. Even the doctors are afraid, unfortunately, are afraid of going to hospital nowadays. Luckily, we only have 4 cases, positive cases of COVID-19 in Benghazi. One has been admitted to the hospital, and the 3 others asymptomatic patients has been isolated. So for now, we are in the safe side, but it is very difficult to access to healthcare these days. I have a neighbor, for example. My neighbor is like 67 years old man. He has a lump in his left breast. He is a male. and it is very suspicious when male have like a lump in his breast. We need to have action very fast because of high risk of malignancy. So he called me to try to find the lab to take cytology, and after like a few days, we find some radiologist who able to take sample, and unfortunately, after that, we need to take a true cut biopsy that need general surgeon. Until now, we didn't find any general surgeon to take this, any doctor to take this true cut sample. So he's very worried about his situation. I am also worried about, because early intervention can cure this man. And this is the situation actually.
And normally, are you able to work with like nurses and community health workers in order to do your work? And right now you're not?
As I said in the story, I quit my job, and but I'm still giving advice and offering my help to people in need when they are asking me. Usually, healthcare when you're providing healthcare to people, it is not only the doctor who are the main actor. Actually, I found very important to have a very good nursing system. So if I have a good nursing system, it's like 60 or 70% of the whole healthcare action. Yes, usually we have very harmony relationship between nurses, doctors, porters, lab technicians, but it's guys, it's after all the system will control the whole matter. It will not work if we have got our talented doctors or good or talented nurses. Without good system managing the whole thing, it will be nothing, zero result.
Mm. And Margaret, can you hear us? Are you there, Margaret?
Hello.
Hi. I just
Hello?
wanted to
Yeah.
describe.
Can
Yes,
you repeat? Yeah. Can you repeat the question that you asked, please, so that I can?
Sure. I wanted to ask how you work with other cadres of health workers to do your work. I know when I was in Nairobi, I met you and your team, and you guys seem to work really well together, even though there were several of you doing different roles. Can you describe that?
Yeah. Oh, yeah, yeah. Okay. Teamwork. Right now, the community health worker in Mathare North is really recognized because the people in the hospital realize that we play a major role in the community as we stand between the community and the facility. So from the nursing officer in charge to the nurses, they really depend on me and the other community health workers. So teamwork has been key, and because of this, where there is a training that concerns COVID-19, trainings that concerns the cervical cancer, I'm very grateful because we have been involved as community health workers. Yeah, previously there was a problem of understanding who a mental mother really is. So the nurses and the doctors never understood the difference between a mental mother and a HCS counselor. But with time, they came to understand the importance of me as a mental mother, because they saw the that journey. HTS counselor was just giving the counseling, but Amenta mother was taking the sick patient on a journey, and slowly we have been recognized in our hospital. So we work as a team right now, and the nurses and the doctors depend on us 100% on just to do the health talk right now. As much as the COVID-19 is concerned, they depend on us on identifying the people in the doorstep where they say who is sick and who has a problem. So I'm so grateful because I can say that in the last 2 years there has been a lot of teamwork, and we have been involved. Though there is a challenge that a community health worker still doesn't know how to use technology. So I think the government is working on that to just take us on a training on how we are going to submit reports using computers. I'm so grateful for putting me to talk about this, because the Ministry of Health really had that. And I can say that that chain between community health workers and the doctors and the nurses, the breakdown that was there, the communication breakdown was there before. Right now we are working in solidarity. It's not like there is a big difference between 2 years ago, from 2018 to now. I can see a very big difference because a community health worker has really been recognized. Before that, a community health worker was not actually recognized so much. And when the Ministry of Health recognized that there are outbreaks of polio, there are outbreaks of multi-drug resistant TB. The problem that they sat down and discussed, and they saw that a community health worker can be very helpful in that. And right now there is teamwork. I can appreciate the teamwork that is there right now. I'm recognized as a mentor mother. I'm recognized as a community health worker. Yes.
That's great to hear, Margaret. So we're going to turn to questions from the audience that Casey will field. The questions for Maxuma, we're saving them up. She isn't able to access her WhatsApp right now for me to ask her, but if she gets on, we'll ask her some questions as well. Over to you, Casey.
Thank you, Sam. The first question I have comes from Assumpta in Rwanda. She says to Margaret, she would like to know if you are doing all antenatal care or only HIV work.
Okay, we give health talks at the waiting bay for all the antenatal mothers as a whole. Then after the nurses and have taken their part on the palpation and seeing these patients one-on-one, we identify with HIV positive. From there, I identify myself with only the HIV positive, and then I check the HIV positive exclusively aside. But initially, when we start the health talk of this antenatal mother, we involve every mother who is pregnant is involved in a health talk, and pre-test group education is done to every mother who is pregnant and who has a small baby who is below 18 months. Then after the mass testing at second place, after the HIV testing at second place, that is where now we identify with the HIV positive mothers, And we separate the HIV positive mothers and the HIV negative mothers, and I concentrate on the HIV positive mother after testing. Yes, thank you.
Thank you, Margaret. I have another question for Malik. In some countries, governments are putting in place different curfews that have been brought about by insecurity and unrest, especially in big towns and cities. How safe are the health workers in such a situation? And what have been any practical mitigation strategies?
Actually, since the 16th of March, the government here in Benghazi established a curfew from starting from 6 p.m. to 6 a.m. and they closed most of the shops and activities, commercial activities, and they prevent anybody to come to Benghazi from outside. They closed the airport also. However, because of the consequences of the economic implications of this curfew, people became very anxious about their income. So the government now decreased the times of the curfew, and they allowed some businesses to open. We still see a very low number of cases in Benghazi. I mean, only 4 cases now. 1 admitted and the 3 are isolated. But the situation is very scary because our neighbors' countries becomes like Egypt, for example. We're hearing that the cases are increasing. I don't know if they are reaching their peak or not yet. We have very unsophisticated health programs. We don't do much testing. We have limited ability to do COVID-19 testing. So we are hoping for the best, but I'm not sure that we are preparing for the worst. Yes.
Thank you. And for the two of you, how do you manage the stress of your job? Maybe we could start with Margaret.
My children are my strength. Okay, children are my strength. Can you hear me?
Yes, yes, please continue.
Hello? Okay, my biggest strength is my children. And I make sure that I communicate as much as possible. Like the way, we were trying to arrange this meeting. It was very exciting to me because when I get in the house, it's only my children and my husband that I see. So I make sure that I communicate. That's why when you got silence that time, I was I told you that you are so quiet. So I make sure that I communicate as much as possible, and then I make sure that I don't sit at one position for a long time. Yes, and when I get in the house, I try to think of the. I try to think positively as much as possible. Like, for example, the time that you gave me the news that I cannot go for the interview yesterday, I had to develop a shock absorber, so I listened to music. Yes, I listen to gospel music, actually. And I also read the Bible and just know that there is somebody who takes care of me up there, that is God. And I use my phone as much as possible just to communicate with my friends and the other mothers. I also make sure that I take a fruit every morning before I leave the house, I make sure that I take 2 glasses of water just 1 hour before I leave my house. And then at 10, I make sure that I take a simple fruit, a banana. And when I come back home, I just make sure that I think positively, you know, I just have a mental state that life is good. That even in when I'm with my children, I enjoy their naughty character. So as much as possible, I try not to think of negative thoughts, so they are there. I try so much to think of positive thoughts. I try as much as possible to communicate with my family. I have a big sister and a big brother, so I try as much as possible to say hello to them. Then I try as much as possible just to listen to music. And, just to tell myself that apart from being in the hospital, I have life on my own. Yes, I make sure that I take water actually a lot. So in the process, I think most of the time water makes me relax. Talking to people like you right now, I'm talking to you guys, makes me relax. And the other way I manage my stress is that I make sure I speak to someone when I have a problem, because as a mother and as a health worker, I might have domestic issues. I might have a problem on my own as a self-stigma. So I make sure that I identify myself with someone that I can really talk to, and just to unload myself. I sing. Yeah, I sing a lot, and yes, that's how I manage my stress. Thank you.
Thank you so much. Malik, we just have about 2 minutes for you to tell us about your stress coping strategies. How do you manage the stress of your job?
Yes, actually, as Margaret has said, communication is the best way to de-stress myself. Actually, I'm sharing my day with my wife, my mother, seeing my friends who are not my colleagues, friends out of my group, you know, just to not share, to mention, I don't want to bring my work issues to my private time. I don't like this. I like to separate my work from my family time or from my friends' time. Yes. I used to be a sportsman, but I used to play tennis. But unfortunately, because of the consequences of the armed conflict and of the ongoing economic crisis, the sport is a luxury nowadays. So hope it will change soon in the future. Thank you.
Thank you both. I think those are excellent strategies, and it's just amazing to know that humans all over the world all find comfort in some of the same things. So I really appreciate that, and thanks to everybody that typed questions into the question box. At this point, we are going to close it out, so I'm going to hand it back over to Polly Dunford to just wrap it up for us. Go ahead.
Well, thank you. First of all, thank you to our courageous health workers. Your stories inspire us. I want to thank you from the bottom of my heart for everything you do every day for your community. And thanks to health workers throughout the world. We want to hear from more health workers. There are so many stories that we need to hear. So through our Frontline Health Worker Coalition, and we've extended Worldwide Health Worker Week video campaign. So for more info, everyone can find that at www.frontlinehealthworkers.org. And there we can upload more videos so we can hear more stories from the field. It's so important that we highlight what you're doing, which helps us serve you better. So for the rest of you, how can we help health workers? So first of all, we all need to appreciate the health workers in your lives. And today's a good step in that, but there's so much more that we can do. We need you, health workers, more now than ever. So we all appreciate you. Also, we can donate. There's a COVID-19 Solidarity Response Fund, which is an effective way to get assistance to our health workers. And then also there's a Working for Health Multi-Partner Trust Fund. These are two good opportunities for donations that will get support to health workers. If you're in the US, call your member, House of Representatives, call Congress. Ask them to support House Resolution 467, which recognizes frontline health workers and the impact that they're having on saving lives, especially during COVID-19. And then please contact us if you'd like to partner with us to help more frontline health workers air their stories and advocate on all of your behalf. So thank you. And we'll talk to you soon. Have a great day, night, evening.
Thank you, Kelly.
Thanks, everyone.
For joining, everybody.
Thank you, Casey.
Malik, you did a really great job.